Okay, everyone, we're going to get started. Good afternoon. My name is Bethany Rose, and I am a policy analyst at NCUI. This webinar focuses on the Health Insurance Portability and Accountability Act and focuses specifically on the changes in the Omnibus rule. Compliance begins on September 23rd, so make sure you're ready. So in this webinar, we're going to go over a number of things. First, we're going to focus on what the Health Insurance Portability and Accountability Act is, and it's important to understand what the covered entities and business associates are in the context of the Omnibus rule changes. The high-tech changes make up most of what changes on September 23rd of this year. Within these changes, there are specifics to keep in mind in regards to privacy, security, and breach notification rules. We will also tackle those. Risk analysis is part of the Omnibus rule change, and it is something that you should focus on while moving forward in the process. There are a number of IHS specifics in the Omnibus rule, and those are definitely important to be mindful of as the compliance date approaches. Finally, we're going to cover what the rule violation changes and penalties are as of September 23rd, and the increases in patient control and the notice of privacy practices you'll need to have at your practice and on your practice's website. In 1996, the Health Insurance Portability and Accountability Act was passed in order to protect millions of employees in the United States. It continues to have authority on security and privacy measures in the healthcare industry, especially as we turn to a more digital-based industry. Privacy and security protections were brought up to date under the HITECH Act, which is also known as the Health Information Technology for Economic and Clinical Health Act. The final rule for this was issued on March 23rd, 2013, and is known as the Omnibus rule. Covered entities and business associates have to comply as of September 23rd this year, or else they could face fines. A covered entity is one of the following: a healthcare provider, health plan, or healthcare clearinghouse. Healthcare providers are only considered covered entities if they are transmitting information in an electronic form in connection with a transaction that HHS already has a standard adopted for. These include doctors, clinics, psychologists, chiropractors, nursing homes, and pharmacies. Health plans are also considered covered entities and include HMOs, company health plans, health insurance companies, and government programs that pay for health care, such as Medicare, Medicaid, and the Indian Health Service, as well as veteran healthcare programs. Finally, healthcare clearinghouses are also considered covered entities. This means that entities that process non-standard information from another entity into a standard format like data content or just a general standard electronic format, or vice versa, are considered covered entities under the Omnibus rule. If a covered entity chooses to engage with a business associate for helping them carry out their activities and functions, there are a few things to be aware of. First, the covered entity needs to have a written business associate contract or another arrangement with the business associate. Second, this contract or arrangement has to establish what the business associate is being engaged to do and require that it complies with the HIPAA Omnibus rule and those that apply to privacy and security of protected health information. Finally, on top of these contractual obligations, business associates are directly liable for compliance with the provisions of these rules. The HITECH Act changes, the Omnibus rule, is important to understand as you work towards being compliant. On the last slide, I mentioned that business associates are directly liable for compliance. This was not the case before the Omnibus rule. They are now subject to the enforcement of compliance by HHS. For the rest of these, I'm going to expand on these changes in the upcoming slides. The HITECH Act strengthens the limitations on the disclosure and use of protected health information for fundraising or marketing purposes. Related to that, covered entities and business associates cannot sell protected health information without authorization from the individual. Patients' rights have been expanded under the Omnibus rule and can now receive electronic copies of their protected health information and restrict disclosures to a health plan for services paid in full by the individual. There have been some modifications to the privacy notices for covered entities, an increase in fines for noncompliance, and changes to the definition of breach. Now the standard is much more objective and the harm threshold is not going to be used. Under the privacy rule changes, there's now a set of federal standards used to protect the privacy of patients' medical records and other health information that is maintained by covered entities. Patients will have significant control and access to their personal health information as well as their medical records. Covered entities are required to establish a privacy officer if they don't already have one. This individual will see all ongoing activities related to the development, implementation, and maintenance of privacy policies. The updated security rule establishes national standards for securing electronic protected health information. These new safeguards are used to ensure the confidentiality, integrity, and security of all electronic protected health information. The new safeguards are physical, technical, and administrative in nature. The new administrative safeguards include risk analysis, termination procedures, authorization, supervision, response, and reporting. We'll focus on risk analysis later on in the presentation. Technical safeguards include having an emergency access procedure, setting up automatic log-off, using encryption and decryption, and having a mechanism to authenticate electronic protected health information. Physical safeguards include disposing of devices properly, keeping maintenance records, having access control and validation procedures, as well as having a facility security plan. The breach notification rule is believed to have the greatest impact on medical practices since it was in most need of updating. When the original law passed, electronic health records weren't used. Today, electronic health records are used throughout the United States and need to be protected. Now virtually any unauthorized disclosure of protected health information could be considered a breach unless your practice can demonstrate that there's a low probability of the information being compromised. The best way that a practice can protect themselves is to encrypt the data within the practice itself and whenever you're using a portable device outside of the office. These portable devices include anything from tablets to laptops or smartphones that would be used to access this data. If you're putting data on a flash drive, you shouldn't use encrypted flash drives as well. You can find encryption tools for your data online and purchase encrypted flash drives from all sorts of online providers. There are two types of data encryption that I want to briefly explain, at rest and in transit. At rest data encryption is for data that's inactive and stored physically in any digital form. So your databases, your data warehouses, spreadsheets, or archives are all examples of what that could be. Data encryption in transit or in motion is for data moving through a network or temporarily residing in your computer memory to be read or updated. If there has been a breach in patient's protected health information, you need to notify the patient within 60 days. You're also responsible for submitting an annual log to HHS of all data breaches that occurred within that year. So data breaches are a real problem for health information. This shows that between 2010 and 2011 that data breaches doubled, impacting a total of 16.2 million individuals. One of the things that you see is that the total number of breaches actually declined in this period, which is a good thing, but there was an increase in the total affected individuals. The causes of these breaches vary. 53% were caused by theft, 20% occurred because of unauthorized access, and 14% of breaches occurred because of loss. Risk analysis was mentioned earlier in the presentation as one of the safeguards that covered entities need to have in place when compliance occurs on the 23rd of September. What is risk analysis exactly? HHS defines it as an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality, integrity, and availability of the electronic protected health information at your practice. Covered entities need to put policies and procedures in place to reduce the vulnerabilities found by performing risk analysis. It was updated under the Omnibus rule, and it was previously known as something called the risk of harm analysis. There are two specific requirements for IHS Federal Sites that I want to focus on this afternoon. First, all of the Indian Health Services sites are required to use security, content, automation, protocol, validated tools in order to comply with FDCC standards and continuous monitoring and monthly reporting. The reason this is required is that it makes sure that your security controls are adequate, up to date, and operating as designed so that it minimizes the risks for IHS and other interconnected government systems. It isn't just your practice that could potentially be at risk. It's all of them. HIPAA rule violations and penalties have changed under the Omnibus rule as well. There are now 4 tiers of violations that are based on increasing levels of culpability. In 1 year, violations of this same requirement or prohibition are limited to a total of $1.5 million. If you violate multiple rules, that number can exceed that amount. In the table in the following slide, you'll notice that the fines aren't uniform. There's a range within each tier, and that's because the language in the actual rule states that the dollar amounts are based on the nature and extent of the violation, the nature and extent of the resulting harm, and other factors, including the financial condition and size of the covered entity or business associate. There are 4 categories of rule violations. Did not know of breach, had reasonable cause to know, willful neglect corrected, and willful neglect not corrected. Fines range from $100 to $50,000. Willful neglect that is not corrected carries the highest penalties, while not knowing of the breach can be for as little as $100. It's important to make sure that your organization is compliant by the 23rd of September so you don't have to worry about potentially having to pay these fines in the future. The Omnibus rule allows for greater patient control. Now, patients will have the right to obtain copies of their health information in electronic format within 30 days of their request, with one 30-day extension period permitted. So covered entities will have 60 days total to complete this. Patients will have the right to instruct their doctor to not share information with their health insurance company if they've paid out of pocket for a test or a treatment. The rule also sets limits on how information is used and disclosed for fundraising purposes and prohibits the sale of an individual's health information without their permission. The notice of privacy practices is changing under the Omnibus rule as far as patients' rights are concerned. Because of this, you'll need to do a few things to be compliant on the 23rd. First, you should send the notice of privacy practices out to your current patients, either digitally or through the mail, and make sure that you post it prominently in your practice and on your website. The notice must describe the ways that the privacy rule allows the covered entity to disclose and use protected health information. You'll need to explain that the entity needs permission or authorization before using a patient's health records for any reason that doesn't relate directly to the care of the patient. Earlier, we mentioned that covered entities have duties to protect health information privacy, and that also has to be in the notice of privacy practices. 2 other things that the NPP needs to describe is the right of a patient to complain to HHS or to the covered entity if they believe their privacy rights were violated, and how patients can contact the entity for more information or for making a complaint. As you work towards being compliant, there are resources available online at the Department of Health and Human Services website specific to HIPAA and the various rules and penalties. There are numerous examples of the different components, including examples of business associate agreements and what goes into risk analysis, and an example of that. The Office of Civil Rights through HHS has a toll-free number for individuals to call if you can't find what you need online. And you can reach them at 1-866-627-7748. For IHS specifics, I've included the website above. There is a presentation that they did last October on this subject and a training video. So when you go there, on the right-hand side, there's a section titled News and Announcements. There should be 2 hyperlinks for that content. There's also a frequently asked questions section and information about the standards necessary for you to be compliant on the 23rd. Does anyone have any questions? Okay, if not, I'm going to conclude this webinar. Thanks for attending, everyone. Have a great afternoon.